Hello, I'm Dr. Ben Beach. I'm a dentist at Shreveport Bossier Family Dental Care. We're here at the Bossier location on Airline Drive, 2119 Airline Drive. We're across the street from the Applebee's, right here by China Flag Buffet. Big strip center, we're easy to find, very convenient for everybody in Bossier. Today I'm here just to let you introduce you to the staff, let you see what the office looks like for all the patients who haven't been here. So come on in, let's check it out. Okay, and this is Ashley. She's our staff member that helps people check in and takes all your insurance information, medical history, all the new patient paperwork. Ashley, how are y'all doing today? It looks like you're pretty busy, huh?
We are busy today.
When new patients come in, I mean, do you recommend them coming a little bit early to fill all the paperwork out? Because I know it can be quite a bit of paperwork, at least that first appointment, and updating all their information and all that kind of stuff. Do you recommend them coming a little early?
You're right, it is. It's a lot of paperwork, so we definitely recommend coming about 15 to 20 minutes before your scheduled appointment time to go to the back with your driver's license and your insurance card on hand. That way we can get everything scanned in and updated for you.
So they need their license, or ID, driver's license, some form of identification, and our insurance, and updated insurance card.
Yes, sir.
What about for parents might bring kids in or minors? They need to have their parent or guardian with them to help fill out all the paperwork and sign HIPAA releases and all that kind of stuff, right?
Most definitely. If you are a parent and you have a child under the age of 18, if you could make sure you do bring your child into the office with you and you have their updated privacy policy form with someone on the form over the age of 18 years old. Okay,
great. Ashley's been with us a few years now. She's seen it all, done it all. She's great team member to have with us. We're lucky to have her. So she's very helpful with all this kind of information. So when you get here, if you have any questions about anything, Ashley's your girl. This is who you talk to. Come on in the back. Let's meet some more of the girls. Okay. This is Erin. She's one of our financial coordinators for the office. She's going to be handling any checkout information, such as re-verifying insurance, trying to come up with trying to figure your estimate of what your treatment's going to cost. Erin's one of our girls that handles all that. Erin's been with us a few years now, and she's worked with a lot of insurance companies, and as far as insurance benefits go, I know the game's changing. They're not paying for a lot of stuff that they used to pay for. Can you give us any advice, or give any prospective patients any advice on the information you need to make this trade-off a little bit easier?
Yes, of course. Okay, well, it's most important that we have all of the information necessary to file insurance correctly. That includes the insured party's name, their birthday, their social security number, address, and phone number. All of that information is needed and necessary in order to file the insurance policy correctly the first time.
Okay. And once again, you've been with us you've worked at multiple offices of ours. You've been around a lot of staff members. Since you've been with us a while, what do you like best about our practice?
Well, I think what sets this office apart is that there is a genuine care for the patients. And that being said, when you come in, from the girl up front who answers the phone and signs you in, to the hygienist that cleans your teeth and the doctor that treats you, every single person has a genuine responsibility and care to take care of you.
That's right.
And there's a lot of teamwork that goes into that. So that being said, it's important for me to have reliable and dependable coworkers, and I do, and I really enjoy that. And
I know we're always meeting and talking about issues and problems. We're trying to get better, and I couldn't be more fired up about our staff we have over here at our Bossier office. They're as strong as they've ever been, and I'm glad to have them part of our team, and they do a great job, and they will do anything to take care of you. So come on and see them. So thanks, we appreciate it.
Yes, sir, thank you.
Let's come on in the back and let's meet some of the clinical staff we have. As you come to the back, you'll see that we have 4 hygienists that normally work here every day, and we usually have 2 doctors. So it's a non-operatory practice. Some of the people are here to get their teeth cleaned. Some people are here to get actual dental treatment done, as far as extraction or fillings or anything they need. But as we make our way down the hall, I'm gonna slip in here to our consult room, and I have another financial coordinator who can talk to you a little bit more about financial options we might have. So Come on in. Let's talk to Ashley. Hey,
Hey,
Ashley, how are
good
you
morning.
doing?
I'm
Doing all
good. How
right?
are you?
This is Ashley. She's our one of our other financial coordinators, and she handles the more in-depth treatment plans that some of our patients might have. And I know the cost of doing dentistry has gone up over the last 10, 15 years, and insurance companies unfortunately aren't paying for a whole lot anymore. So she does a lot of creative financing to make sure our patients can afford treatment. Can you talk to us a little bit more about this?
Yeah.
About financial options that we have here?
Yeah, one thing that we do offer, we are providers for Care Credit. It's a third-party financing company. It gives you the option to pay 6 months or 12 months with no interest. It also does have other options with an interest rate of 14.9%. It can go up to, I think, around 60 months.
If they finance it for a long time.
If they finance it for a long time, yes, for sure. We also have something that I'm actually love to talk about is our membership program. Not any other dentist around here offer that. It's not an insurance. It's for our non-insured patients for an activation fee of $89 and $34 a month. It covers 2 cleanings, 2 exams, any needed x-rays at 100%, 1 emergency visit a year at 100%, and then it gives you 20% off all of your dental services, so it helps out a lot out of pocket.
So for our patients that don't have insurance at all, this
Yes.
is a great service for them.
Yes.
And it's well worth the money.
Yes, sir, and
I
I
think if you
help.
do the math on it, if you come in to have your teeth cleaned once or twice, it's paid for the whole. That alone is paid for the program. So
Yes, sir. And I have the option to help our patients come in here quietly away from everyone else and sign them up for that.
That's
So
right. That's
if they
right.
don't have a whole lot of internet
capabilities,
education,
right,
yeah,
capabilities,
then I can
yeah.
definitely help. I've done that with a lot of our patients.
Right. And Ashley does a lot. Speaking of insurance again, you do a lot with insurances, calling insurances, trying to find out, will they pay for this patient's bridge? Will they pay for this root canal? Is there a waiting period? Insurance companies now have thrown so many curveballs at us that we're trying to rein in all this information we need to make sure we're giving you an estimate that's pretty close to what we feel like they're going to pay. Even then, sometimes they still won't pay for stuff, and I know that's becoming a big problem. So we've hired insurance specialists such as Ashley to kind of take over some of that headache from us and try to figure this thing out more. But any questions you have about insurance or billing or financial options that you may have to help you afford treatment, Ashley's your girl. She's great at what she does. She's easy to talk to. She's a smart girl. She knows dentistry. Any treatment questions you might have, she'll get the answer for you. So Ashley's a girl you want to know when you get over here. So, well, thanks for your time. You've been here, a few years now with us, and boy, every month she grows into the team member we love to have around here. She's very positive. We're glad to have her part of our team, and once again, like I've said before, I'm more fired up about the staff we have over here than than I ever have been. So man, we got some great girls that work over here, so y'all come and see them. So let's go visit some more of the clinical staff. Let's go check out one of the hygiene rooms. Hey Cassie, how you doing?
Hey, how's it going?
This is Cassie. She's one of our hygienists over here at our Bossier office on Airline Drive. You've been with us here, what, almost 5 years
5
now?
years,
So you've
yeah.
been here with us a while.
Yeah, quite a while.
As a new patient coming in, some of them aren't really sure what to expect as far as a new patient cleaning goes. Their first cleaning at the office. Can you talk to us a little bit about that visit and what they can expect when they come see us for the first time?
Yeah, of course. First of all, we just start by getting to know each other. Discuss medical history, friends, family, cats, dogs, and we start by taking some x-rays. We'll actually be able to pull those x-rays and digital images up on the screen so that you see what we see. That's really important here. After that, we'll get the doctor in, and Dr. Beach and me and the patient will all together take a look at everything and get a treatment plan that works for you. Obviously starting with your chief concern, whether that be an extraction or something restorable like a crown or bridge work. We'll also evaluate your gums. This is a very useful tool here. We'll check your pocketing, check for any signs of gingivitis or gum disease. Of course, start your cleaning, and end by answering any questions you may have. We're a wealth of knowledge here, and we love talking about teeth.
That's right. And even with our hygienists and the rest of our clinical staff, we're always meeting and talking dentistry, trying to get better. And man, our hygienists are phenomenal here. And our hygiene staff as a whole is awesome. We got a great team of hygienists that are very good at what they do, and they are very good with our patients. They care about our patients. They talk to them. I mean, y'all get to know our patients like they're one of our family. And Cassie's an integral part of the hygiene department over here at Bossier. And I know y'all, you're checking for signs of gum disease. You do some gum measurements, some probing, and once again, one of those another things she mentioned, and I'm going to kind of elaborate on that, is we're always here to address your chief concern. But legally, we're legally obligated to tell you everything that you have going on in your mouth. So we're going to give you the comprehensive treatment you deserve, and we're going to tell you everything, but we're going to address your chief complaint. And that's what we're here for. We're here to help our patients and to do whatever they want to do. We're going to tell you what you need, but we're going to give you what you want, and that's kind of our motto. But we've got great staff, great hygienists that kind of reinforce the comprehensive care that we as the doctors expect out of our entire staff. And once again, Cassie is a great part of it. You've worked at other offices before. How does our office compare to the other ones that you worked with?
I think it really comes down to quality of care.
Yeah.
I've never worked in an office that gives such a comprehensive view of the oral cavity and really gives the patients the tools to take care of it and really just achieve the smile.
It's not even the mouth too. We're taking blood pressures. If you're diabetic, we're checking blood sugars. I mean, we're calling your doctor, your physician. If we see something medically that we don't feel is right, we're getting on the phone and calling your doctor and say, all right, this is what we're seeing, what's going on, and so it's true comprehensive health care at the dental office. And you've witnessed, just like I have, we've diagnosed a lot of people with very high blood pressure that didn't even know it. And we had one patient that basically said, y'all saved my life. I had high blood, didn't know it. I go to my physician immediately that day puts me in the hospital. I'd have triple bypass surgery. He said, y'all saved my life.
Yep.
And so it's very important for us that you get the comprehensive care that you deserve, and not only in the oral cavity, but also your overall health. So, and the hygienists are kind of on the front line to help us with that. So Cassie's great. Y'all come see her. I'm glad to have her. So let's go meet some more people. Thanks. This is one of our hygiene operatories. As you see, we've got TVs in every room. We have digital x-rays, low radiation digital x-rays. We have computers in every ops. We have headphones to listen to. We've got iPods to listen to. We try to make things as comfortable as we can. And I just kind of want to show you, this is what one of our hygiene operatories look like over at this office. Now that you met one of our hygienists, come on back and let's meet some more of the clinical staff. Hey Cassie, how are you doing?
Good.
This is another Cassie, and believe me, not everybody over here's name is Cassie, but we do have two Cassies at this office. This particular Cassie has been one of my personal assistants for going on 9 years now, so quite some time. She's our clinical leader, clinical director over here at our Bossier office. So anything pertaining to the clinical part, the doctor part of the practice kind of filters through her. Cassie, you've been with us a long time. Obviously, we're keeping you happy, so
Yes.
I'm glad to hear about that because it would kill us if we lost you.
Doing
But
something right.
yeah, right. You do. Yeah, that's right. Like I know, we've got a lot of nervous patients. What sedation options do we offer? Can we offer these patients as they come in to help them relax, help them be a little bit more accepting of dental treatment, and to make their overall experience at our office a little bit better?
We've got 3 different levels of sedation. So the first level would be nitrous, and you can come by yourself. You don't have to have a driver or anybody. They put the little gas mask on your nose, and it kind of relaxes you, makes you a little tingly. And then as soon as we take it off, we flush you with some oxygen, and you're good, and you're ready to go. The next level would be oral sedation, and that is medicine that you take, like Valium, Halcyon, something like that. You do need someone to bring you that day. They would need to stay with you, kind of take care of you for the rest of the day. But it does give you that amnesia effect, so you really don't remember coming in, being here at all sometimes. So, and then the next level would be IV sedation.
That's right,
We have
yeah.
a CRNA come in. They actually place an IV, put you to sleep. This is a good option if you've got a lot of treatment that you need to do. Go ahead and put you to sleep and get it done, and you don't even know that you've been here. So
That's right.
it's a great option.
And we're seeing more and more patients accept that,
Right.
that sedation piece that we have to offer. And that's for the patient who's so nervous to walk. I mean, they're out there. I've got a family member who is terrified to come to the dentist. And now we're slowly winning them over, but the first couple times they had a real bad experience when they were a kid, and it traumatized them. And and that IV sedation was the only reason that he came in and allowed us to do treatment on him. And we've also got patients out there that may have some medical condition that lends us to accept the fact that IV sedation is the only way they'll be able to get treatment. So it's not even only for the real scared patients,
Right.
also for the patient who might have some medical conditions that aren't conducive to coming into practice, letting us get the teeth numb and working on them. So we've got options that can meet everybody's needs, which is great for us, great for our patients, and along those same lines of helping people, helping our patients. I know we do a lot of charity work, throughout the year, and we've actually got something coming up
Yeah.
here pretty soon.
Yeah, actually we have we're doing the Race for the Cure with Susan G. Coleman. Unfortunately, we have someone that is having to fight that fight, but we're supporting her. And
That's the breast cancer awareness.
breast cancer awareness, yes. And the office as a whole is we've got a team together, and we're raising money, and we're gonna do that race.
That'll be fun. Usually we try to do 2 or 3 charity events throughout the year to help people that need any help, anything we can
Yeah.
lend them.
Yeah.
And last couple of years we've done some races to help children with cleft palates, and we've raised a bunch of money for that.
Right.
And this year, like Cassie said, one of our own girls, who's like a sister to all of us, she was diagnosed with breast cancer, and so we're raising money, raising awareness for breast cancer through the Susan G. Komen Foundation.
Yeah.
And if you come in September, October, you might see us all in pink.
Yes.
The doctor's wearing pink scrubs, the staff's wearing pink. We're just raising awareness for breast cancer, and we also do the Trading Smiles, and
Smiles.
it's usually in the spring.
Right, it's usually in the spring. That's an amazing thing that we do at our South Shreveport location, and people come from all around. They come from Texarkana, from Dallas, from Manning, places all over. And what we do is they bring some canned goods, and they can either get a cleaning, an extraction, a filling, something like that. There are a lot of people who can't afford to come and get dental treatment, and this is a great option for them. They can come in and we help them out. We don't have a lot of money to give, but I have skills that I can give, and that's a great way to give back.
Sure, right. And what the patient does, they bring in the canned good, like you said, we do free dental treatment on them, and then we gather all those canned goods and we donate the canned goods to local food
Right.
banks. So it's kind of a win twice. Win for the patient to get treatment, and win for the homeless shelter.
Right.
It's a great canned food drive for the area, and once again, our office is about helping all the people we can help. Our community's been good to us. We want to be good to the people that need our help.
And it's a fun day.
Yeah.
Everyone's fun. They're having fun.
Yeah. And our
hanging
staff,
out.
they volunteer our time. Our
We
doctor,
love it.
nobody's getting paid.
It's great,
It's
yeah.
totally voluntary. You don't have
Yes.
to come if you don't want to, but
Yeah.
usually 95% of our staff is there. And we have a lot of fun with it, and we help a lot of people. And we start at 7 in the morning,
Yeah.
and people are lined up outside in the parking lot at 2 or 3 in the morning before. It's crazy, but
fun.
it's just one of those other things that sets our practice apart
Yeah.
from others.
Yeah.
So, well, thanks. Appreciate your time,
Yeah.
and let's go meet some of our doctors. Thanks. Okay, y'all, this is Dr. Hastings. She's one of our doctors here at our Bossier office on Airline Drive. Now, Dr. Hastings, you work what, Tuesday, Wednesday, Thursday, Friday? So
sir.
kind of later on the week. You you know, if you come on one of those days, you might see her. She's actually married to Dr. Michael Haydell, one of our other doctors at our South Bossier office. I don't know how you put up with him, but good
touch
for
and
you.
go.
Pretty tough. And as far as you know, as patients come into our practice, I know we try to make them feel as comfortable as we can. You know, I know you have a pretty loyal patient following yourself. I mean, what are some of the tricks that you kind of pull out of your hat as far as making our patients feel comfortable and have a good dental experience?
Well, we have blankets, that's key. I am always cold, I always have my jacket on, and so I
Yeah.
always make sure to offer people blankets. We have little neck pillows. We get creative sometimes if people have neck and back problems. We have little towels we can roll up, but try and make them as comfortable as possible.
That's right. And I know we do some sedation. Cassie talked to us a little bit about that. And I've kind of found as a practicing clinician myself that, man, some minimally sedative procedures such as the oral sedation or, you know, even the nitrous, man, it really helps relax people.
Yeah,
And,
it's a trust thing. Coming in, you have to at least trust us to let us work on you.
Yeah,
so
that's
once we
right.
get past that barrier, it
That's
always
right.
makes things easier.
and you've been with us a few years now, and I know you've worked at other places before, and I know you've got a very large network of dentists that you still are in contact with. I mean, what do you think makes our practice a little bit different, you know, than most dental practices out there?
Well, we enjoy working with each other. It's a great environment to work in. We're happy, we have a good time, and I think everyone can tell that.
Yeah. I mean, we've got a great staff here. You gotta
Yeah,
admit, man,
they keep me straight.
Our hygienists are on point. Our clinical staff is wonderful. Our front staff does a great job handling insurance and billing, and we're a very collaborative group of
Right. It's always nice to have people around.
That's right. And so, I mean, we're lucky to have you, and we're lucky to have the great staff we have. So y'all come and see Dr. Hastings. So what? Tuesday through Friday, she's here, and she's actually from Alabama.
Alabama.
Yeah.
I'm an Auburn fan.
She's an Auburn fan. So all the LSU
That's all
people,
that
let's not
matters.
crucify her too bad. But she's a really good dentist. She cares about her patients, and you know, we look forward to seeing you. So, thanks. All right. I'm here today with Dr. Wishoff. He's one of our other doctors that we have working at this Bossier location. And he's here, Monday, Wednesday, Thursday, Friday. So
Every day but Tuesday.
Every day but Tuesday. And he's been here a little while with us now, a little over a year. And Doc, I know you're doing everything, from root canals to fillings to crowns. I mean, restoring implants, doing dentures, pretty much doing it all, right?
Yeah, pretty much.
Yeah. Anything the patient needs, he can take care of.
Yeah.
What about like emergency patients? We get a lot of, you know how our practice is, we get a lot of emergency phone calls, people with toothaches that maybe hadn't been to the dentist in quite some time. Is it pretty easy to get them in?
Oh yeah, it's extremely easy. We've got 4 offices,
Yeah.
and we're
That's right.
really good at accommodating our patients. So even if we haven't met you before and you have something come up all of a sudden, you just give us a call. And there's 2 doctors that work out of this office on any given day. So if I can't see you, the other doctor, Dr. Hastings, that works out of this office could, or Dr. Beach when he's
right.
here on Monday and Tuesday. So normally, if you get to us before 4 o'clock, we can get you in the same day
Pretty
and get
much
you out of
quickly.
pain.
Yeah. I mean, even if it's just to write you a prescription for some antibiotics, and you know, just like you said, just try to keep the patient from being in pain. I mean, we're going to do whatever we can to accommodate our patients. You know, if you're having a problem with a crown or filling, we're going to try to squeeze you in on the schedule some way and get you taken care of. That's the great thing about working in a group practice, is the fact that if I can't see you or I'm out of town, or if you're out of town, I can see one of your patients and vice versa.
Exactly.
That's why I love our group practice, and it makes it easier on our patients. It's easier on staff. We never have to shut down. We're even open on Saturdays. You and I work Saturdays, you know, pretty often.
At our
South
Shreveport
Shreveport office, that's right. And South Shreveport office is open on Saturday, so if you need Saturday appointments, we can see you down there. You know, I know you've got buddies out there that are dentists. I know you collaborate with them. You know, what do you think maybe sets our practice apart from, you know, some of the other ones out there? We've got great staff.
Yeah. I mean, a number of things. Large group practice, the fact that we're open on Saturdays, multiple locations across the area. Staff is great. They're caring. They work just as hard as we do, if not harder, to take care of the patients.
That's right.
I mean, everybody's in the we're all one big team here. We all have one goal, and that's to take care of our patients and make sure they're comfortable and they get
And we
good
meet
care.
monthly about stuff like this, and that's always the main goal of our meetings is do what's right by our patients, and we'll be fine. We're taking good care of our people, and just kind of add on what you said, our staff is phenomenal. And I've brought this up many times in this video, just of how they are basically the driving force of this place. And they care about our patients, they care about the work, they care about the practice, and we as doctors couldn't work for a better group of girls than what we have now. So,
I agree.
well, great. Well, anyways, Monday, Wednesday, Thursday, Friday, he's one of our doctors here. You might be seeing him. He's a great guy, a great friend, he's a great clinician. He's very warm and welcoming, and we look forward to seeing y'all.
Yeah, thanks. Call.
Thanks.